Thank you for joining in this morning for our session on breastfeeding and baby care, and also a little bit on life after baby. We are almost ready to start, just a couple of minutes more, waiting for all the other mothers to join in. But in the meanwhile, I thought I'll just give you a little heads up. You have been kept mute during this session because we are going to be recording the class also, and later on after the session you will get the recording link, so that will help you to recap, revise, review, etc. And if you have any questions, in the box next to you there is a question section, so please put your questions in that, and I will make sure that I answer all the questions before I close the session, right? So just 1 or 2 minutes more. In the meanwhile, if you can grab a bottle of water and make yourself super comfortable. If you want to make some notes, you can have your pen paper handy, so that you don't miss out on asking any of your important questions. Would be the main focus, right? So just 1 or 2 minutes more and we are going to begin. All right. So, anyways, it's time. So we are going to kind of get started. So once again, a very warm welcome. This session has been brought to you by Cordlife, which is one of India's leading stem cell banks. Also, this is by Dr. Meera Agarwal. So thank you, Dr. Meera, for allowing this kind of a session to happen. My name is Sonali Shivlani. I am a pregnancy and postnatal consultant. I have been practicing for more than 16 years now in this space, based out of Bandra, Mumbai. Right now, because of COVID, we've been doing online sessions. Actually, I used to do a lot of sessions at Agarwal Clinic as well over the last few years. But again, because of COVID, all the sessions have become online. So therefore, we've been doing these webinars. So we've done a series of 3 webinars. The first one was on diet, exercise, and pregnancy information. The second one has been about labor and delivery preparation, including the breathing techniques, etc. And now this last session as a series is on breastfeeding and life after baby. So it has been Dr. Meera's concept that, for her clients, she brings an entire pregnancy class in this format, so that the mothers are prepared and comfortable with all the aspects of pregnancy, birth, and the period after. So without taking more time, I'm going to move on, and we're going to talk about today's topic of the day, which is breastfeeding and life after baby. As I've already mentioned, you are on mute, and the session is being recorded. For any questions, you can put it in the question box, and I'll make sure that I answer before I close the session. Also, this recording will be shared with you, so you will have a chance to review and kind of recap on the same, which is an option for you. All right. So let's move ahead and let's get started. So the first, obviously, important conversation is breast milk, right? That's breastfeeding. A lot of people kind of think that it's natural, it's normal, and yes, it is natural, it's normal. It is something which we don't have to we don't have to worry about, in terms of is it something which is good, not good, etc. But the question is always, is it the right choice for me? If you actually see this picture, I have put a picture of a golden colored liquid, and that is exactly what we call breast milk now. We call it liquid gold. So whether it's for the baby or for it's the mother, it's definitely the right choice. If I were to go into it, there are 100+ advantages that breastfeeding may have, whether it's for the baby, whether it's for the mother, whether it's for the family, whether it's for society as a whole. But just some of the very few important ones. It is the right food. It's available at the right time, right temperature, right quantity, everything in the right composition for the baby. It helps to build immunity, helps to prevent allergies. It pretty much helps in the gut formation for the baby. And it's a lifelong benefit. So it prevents a lot of, childhood related concerns and diseases as well. From the mother's perspective, it's going to help you to lose weight. It is going to help your stomach, that is your uterus, to start shrinking because it aids in the involution. It's super convenient and it's free. So, even if it's the middle of the night and you want to feed the baby, you don't have to wake up, you don't have to leave the bed, you don't have to prepare the formula, and you don't have to sit and sterilize bottles, etc. So there's a lot of benefit in just directly latching the baby on. It also gives you protection against various hormone-related cancers like breast cancer, ovarian cancer, cervical cancer, etc. So it's definitely to your advantage to give breastfeeding the best possible shot that is there. So here are a few things that you should definitely keep in mind. First and foremost, as soon as the baby is born, get started. The first 1 to 1.5 hours is actually called the golden hour. And even if you have a cesarean birth, it is possible to latch the baby on. So you can ask the nurses to help you. They will help to latch the baby on directly to the breast, and someone will hold the baby for you. So that is something which is very important. Now, why are we doing that? There are lots of reasons for that. First and foremost, the baby right now in your stomach is in a quiet, cozy, dark, snug environment. Once the delivery starts, the process of birth starts, the baby is kind of, going through all those contractions, and the baby gets pushed out into this world with a lot of force. And now the baby is in a new environment. So there is, there is a lot of noise, there are lights, it's bright, it's like, there are human beings. So the baby's feeling is, I'm scared, right? But when we put the baby to the mother's chest, the baby hears the mother's heartbeat, feels the mother's pulse, and the baby calms down. So now the baby becomes alert. The baby is alert, but now the baby is not hyper alert. The baby is active alert. And the baby is feeling comfortable. The baby is feeling secure, which is ready to learn. The baby will be ready to start the learning process. So the baby will learn very fast at this point of time. Also, it helps to regulate the baby's body temperature, heartbeat, everything, right? So it's excellent for the baby from the baby's perspective. After this, the baby is going to go to sleep. So after 1 to 1.5 hours, 2 hours after birth, the baby now is super exhausted because the baby's seen so much, right? So the baby tends to fall asleep. And this is called recovery sleep, which can last for a few hours, sometimes even a whole day. The baby in this state will be very difficult to awaken, and even if the baby wakes up, the baby will go back to sleep in a few minutes. So the first day pretty much goes like this, which is why that first feed becomes really important. It introduces the baby to the mother to the baby. The next thing we have to do is ensure that the baby is latched well. Now, maybe in the first feed, that is not necessary, that is not required. The first feed can just be nuzzling, where the baby comes to the breast and is just nuzzling, is just licking, is just kind of, getting to know the mother. However, after that, once the next feeds start, the latch is extremely important. So I have my friend here who's my breastfeeding fluffet, who will show you that the mouth has to be wide open. The baby has to get a major portion of the areola in the mouth, not necessarily the whole areola, a major portion of the areola. And if you see, the lips have to be flanged open. So that's a good breastfeeding position. And this is something which mothers will need to work on. So you can encourage the baby to open the mouth wide by pulling at the chin, maybe squeezing the breast a little bit. So encouraging the baby to open the mouth wide, which is going to ensure the latch is correct and you're going to get less pain, less discomfort, and etc. It's also important that you are comfortable because breastfeeding, the baby can feed 8 to 12 times a day. And each feed could last for about 45 minutes, which is a lot of time. And therefore, making sure that you're comfortable is going to be really, really important. Please remember, the more you feed, the more milk you are going to make. So right from day one, right from the word go, latch the baby on often. I've said 8 to 12 times, so every 2 hours, latch the baby on because that is what is going to help, the milk production to get started and later on for the milk production to get established. That is your baby's stomach size, right? It's really, really tiny at birth, which means the capacity is about 5 ml, and we don't really need to worry about how much milk you're producing. So if you're producing just a few drops, you don't really need to worry. But the baby's stomach grows very rapidly, and by the time the baby is about 10 days old, the stomach can be the size of an egg. And then the baby obviously is going to require more milk. So if the mother has not done the stimulation from the very beginning, the baby will start depending more and more on formula, which is not something that we are interested in. So we are going to aim to increase our milk supply. We have to ensure that we're feeding at least 10 to 12 feeds per day. Don't skip feeds. Don't, be lazy for a particular feed that, let me rest a little bit. A lot of times mothers ask me this question. At night, if I don't feed and somebody else feeds the baby, then is that okay? But then that's not okay in the beginning because here we're trying to establish the milk supply. Make sure that the latch is correct. This is extremely important. The latch should be absolutely correct. Do not use a bottle to give top feed or expressed milk because a bottle, the feeding pattern is very different. The feeding style, the jaw movement is very different, and this can cause confusion, and therefore the baby will become more and more lazy at the breast. And this can, honestly, it can happen with just 1 or 2 bottle feeds also. So just giving once or twice the bottle can create a problem, which will mean that it's very difficult to get the baby to come back to the breast. We recommend that you should drink plenty of fluids, so about 12 to 14 glasses per day. We're looking at water, coconut water, nimbu pani, things like that, clear soups, clear juices. But over and above that, at least 8 to 10 glasses of regular water is also very essential. Stress and anxiety. These are two things which are going to definitely reduce your milk supply. So it's important that, you're not stressed out, you're not anxious, you kind of, just keep yourself relaxed. Things are going to be up and down. As a new mother, you're going to be learning a lot of things and you will make a few mistakes along the way, which is okay. So that doesn't mean that you should get stressed out and anxious about it. Express a little milk after every feed. So if you feel that your supply is less at any point of time, after the baby is latched on and done, then use a breast pump or hand express some milk after a feed, which will teach the breast that, there is some more that is required. So that additional stimulation will teach the breast that more milk is required. So therefore, I need to latch the baby on. I need to produce more. So the breast pretty much works as demand and supply. And the more the demand, the more the supply. These are some common concerns that can come up as far as breastfeeding is concerned. So the first couple of days you have no milk, you're making just a few drops, and then suddenly the breasts become really hard and become heavy and full with milk. And this can be engorgement. This can make it really difficult for the baby to latch because the breast is very, very tight. What is best done is use a warm compress, do a little gentle massage, express a little milk to make it a little soft, and then latch the baby on. Wear a bra because that will help to support and contain the breasts. And, just make yourself comfortable by doing all of these things and feed the baby often. If engorgement is not attended to, it can actually, cause a little bit of fever and etc. It's normal for your breasts to leak. So I'm feeding on one side, the other side starts leaking. That's normal. It's just annoying, right? I mean, it's just a little embarrassing and etc. So it's a good idea to wear a breast pad. That will be helpful. So you can wear a breast pad, which will help to support the leaking part of your breasts. So kind of, take care of that. But change these breast pads often, otherwise that can also cause infection. In a few weeks, once breastfeeding has been well established, the leaking is going to pretty much stop. So don't worry about it. I have a lot of mothers who will call in and say that my milk has disappeared. And I have to tell them, relax. It doesn't work that way. Your breasts are fine now. And there is absolutely no problem. It's just that the demand and supply have now reached an equilibrium, right? Then come abdominal cramps. So remember I said one of the benefits of breastfeeding is it helps the and as the baby starts latching on, as the baby starts stimulating the breast, there is going to be the involution or the uterine cramps, which will make the uterus start shrinking. So this can last for about 4 to 6 weeks because that's the time that it takes for the uterus to really go back into the pelvic cavity. If your latch is not correct, you are going to have sore nipples. So make sure that you take good care of your latch right in the very beginning if it's paining. So a little bit of sensation is normal, but if there's pain, then that's something that should be attended to immediately. You should stop, you should correct your latch, you should change your position, do something, reach out for help. There are lactation counselors, consultants who can help you to correct all of these issues, because if you allow the pain to continue, then it's eventually going to become sore, then you might get cracks and you'll have bleeding from the nipples, which can make breastfeeding stop. And then that's not something which is fun. I would strongly recommend that all mothers during the breastfeeding period should do a gentle breast massage every day. And here's how you do it. You are going to start with, do it in the shower with warm water and soap. Keep your hand like this so that the breast becomes nice and tight. And you're going to use your fingers to start with the armpit. So you kind of massage your armpit in gentle circular movements, and then you massage your breast all over the body of the breast in circular movements. And then whatever areas you massage like this, just do gentle strokes like this towards the nipple. Now, this is going to help you to understand if there are any lumps forming, if there is any milk blocking any of the ducts inside your breast, and you'll be alert for it. If you feel lumps, again, it's, reach out to your doctor. You can reach out to, as we also do lactation counseling sessions, and we do these via video calls now. So it's really, really convenient. So make sure that you reach out for help. If you kind of, let it stay for a long time, then that long time can actually mean about 48 to 72 hours. Then that lump can become infected. So as a lump, it's not harmful, but as an infection, it's a problem. So we definitely are not looking at a breast infection coming up, because breast infection means antibiotics. If it becomes like an abscess, then it becomes a surgical removal or draining of that duct. Which could also mean that we have to say that, hey, you can't breastfeed your baby. So then that's something which, is important to keep in mind. Now, breast milk can also be stored. So, if you're thinking, and that's what generally happens, that, mothers who are going to go back to work soon or who have commitments like that, maybe you have an older child. So you start thinking that it's okay, let me just not get to breastfeeding because it's a lot of work. So don't worry about it. You can actually express breast milk and keep for your baby. These are the temperatures. At room temperature, if it's about 26 degrees, it can be kept for about 4 hours. In the refrigerator at 4 degrees centigrade for 48 hours. If you have a deep freezer, that double door fridges, set it at -16 and you can keep it for 3 months. And if you have a special freezer, then you can keep it for almost 6 months also. And the general question is it safe? Yes. Is it still nutritionally sound for my baby? Absolutely yes. So the next question is, how do I express breast milk? And we have various methods. We can hand express manually. We can use a manual breast pump. or we can also use an electronic breast pump. Let's take a look at these options. So when I'm hand expressing, I have seen a lot of mothers do this. They kind of press like this, which can become a little bit of a challenge. And we definitely don't want that. The way that you hand express is you use your thumb and forefinger, place it outside the areola, just a little outside the areola. And the first thing you're going to do is you're going to push back against the chest wall. So it's push back against the chest wall and then compress, right? So it's push back against the chest wall and compress. It's push and compress, right? So once you're done with this portion, after maybe 4 or 5 such compressions, you can slowly shift your finger to another quadrant of the breast and then so on and so forth, right? And then of course you can keep going round and round till you're getting the milk. So this can help you to actually effectively express breast milk. Even if you are pregnant and you are thinking, do I need to buy a breast pump or not? You don't need to. You can do this in the initial period and you can decide on what kind of a breast pump you want at a little later date also. These are manual breast pumps, which are, the advantages of manual is obviously that it's cost effective. It doesn't cost so much. And there is really no mechanism, machinery that is going to get spoiled. So from that perspective also, it becomes a lot easier. So what we are obviously, but the only disadvantage is that you have to use your hand. So it's constant, that pumping cycle has to be done by your hand. So at that time, it's very difficult to do other things. Many mothers, they have an electronic breast pump. They actually can latch the baby on one side and pump on the other side because it's the machine which is going to do the job. They don't have to use their hand. So that's one of the disadvantages. But otherwise, if you're an occasional express need that you don't need to express regularly, then a manual breast pump will work just well for you too. Then we have electronic breast pumps, and these are broken up into 2 different variants. You have the single pump and you have the double pump. So if you are going to go back to work really soon, maybe you need to rejoin work at 2 or 3 months, or if you have twins, or you have a special needs baby, by chance it's in ICU or whatever, some issue is there, and you want to express a lot, a double breast pump can be really helpful. So then that's an investment that would be worthwhile. But again, if the baby's going to be almost 6 months by the time you're going to go back to work, you just need to express 1 or 2 feeds in a day, then you can use a single breast pump also. So it's a very personalized choice depending on your need. It's also of course budget oriented, but the main question is always the need. So depending on your requirement, depending on your need, is going to be your choice of an electronic breast pump. Are breast pumps painful? No. If you use them correctly, they're not. You always ensure that you set the suction and the speed as per your comfort. So if you get an electronic breast pump which does not give you the option of suction and speed, then that's not something that you should buy. It might cost very less in the market, but it's not worth it because it does not have settings for suction and speed. But if you can, and it's okay, it's not necessary that you have to have a speed of 5 and a suction of 5. You could do very well with a speed of 3 and a suction of 2, and that's fine. So whatever is comfortable for you is what you have to kind of consider using. That was about breastfeeding. And now we're going to talk a little bit about your newborn baby. These are some of the things that you are going to require. So the first thing we would recommend is decide on where you are going to have your baby sleep. A lot of parents have this question mark that, should the baby sleep on the same bed with me? Do I need a cot? And then, of course, the Western pattern or style is that the baby is in a separate room altogether with the baby monitor. So you have to decide what works for your family. There's nothing right, nothing wrong, but a separate bed is definitely recommended, whether it's a bassinet or a cot, right next to the mother's bed so that breastfeeding becomes easier, would be, at least in initial newborn phase, one of the most ideal scenarios. And the reason why I'm recommending a separate bed, recommending something, normally I would leave the choice to you, is that at least there's no chance of your bed covers, your hand, your body rolling over onto the baby. And the space which is left, that is your husband's space, is not taken up. So husband also doesn't need to leave the room. So the baby can be in a separate bed, but accessible. So whenever the mother needs to feed the baby can be picked up. Nappies, diapers, these are all question marks that we always have. Whatever you choose to use is fine. Nappies are cloth, diapers are disposable. The choice is yours completely as to what you would like to kind of, pick for your baby. Diapers are obviously convenient and they can be used for, nighttime, for traveling. You can use diapers 24/7 also, but if you choose to use diapers 24/7, make sure that you're using a diaper rash cream, because that is what is going to create a barrier between your baby's skin and the diaper. And that will be helpful to prevent rashes, and change diapers often, right? You need clothes. So we need, front open cotton clothes. All clothes that baby wears have to be cotton. Don't get fancy, don't get synthetic, woolen. Even though winter's around the corner, babies don't need woolen. You should layer the baby in multiple layers of cotton. That will help, in keeping your baby snug and warm also. Many babies like to be swaddled, but swaddling should be loose. We don't need to kind of, swaddle baby like a sausage, like completely tight. That's not the idea. The baby comes from the womb, which is a snug environment. So we need to create a snug environment. We don't need to create a tight environment where movement is not possible. In the womb, the baby is moving, right? Caps, mittens, and socks. I think these are more important for the relatives, because everybody is saying, oh, usko thand lag jayegi. So therefore, we need a few of these. But on a general note also, babies do lose a lot of heat from the top of their head and the soles of their feet. So these areas, if they're kept covered, then that's definitely welcome. And you can you can keep the baby in an air-conditioned environment, especially now since it's warm. But once it's December, Jan, then air conditioners will not be required. This is COVID time. So we are obviously kind of, bathing the baby ourselves. We don't, have bath people coming in, the japas, the maids, all of those are pretty non-existent. We are avoiding also. So we need some bathing equipment. Invest in a good bath chair, which will be helpful to, bathe the baby. And that is something which is available in the market. It will help you to be hands-free. But of course, remember that you can't leave your baby alone in that bathing area. You will also probably want to massage your baby. Doctors recommend do not massage baby, and at least in the initial few weeks, because the cord needs to fall off, the skin is still so sensitive. So it's better to wait for a while, and then also do a patch test. Do a small patch test in a small area for a couple of days. And if there is no reaction, then you could consider doing the massage. But the massage for the baby should also be done by the parents or grandparents. No outside person should massage the baby. Baby massage is supposed to be light and gentle. We don't need, like, we're not straightening up the baby. We're not, forming the bones. We're not strengthening the bones. All that is all myths, right? Hygiene items like soap, shampoo, nail cutters. Babies are going to be born with long nails, so you're going to definitely need that. So just kind of, keep those handy and ready. And then if you want additional things like a carry cot, a pram, a baby carrier, baby wraps, all of those, and that's something that is a very personalized choice. Here are some common concerns that, parents would have. So I'll show you a few pictures of all of these things so that, you kind of get a little fair idea of what to expect. So that's the first, the way the baby's head is shaped. This is very normal. You have to understand that the baby is upside down in the womb and is in the pelvis. The pelvis is like this, right? So if the baby's head is upside down, the gravity is going to pull the shape of the head into this kind of a elongated shape. Also, when the baby is coming out of the pelvis, that also adds to the additional molding, which is normal, right? So this is going to settle on its own. We don't need to do anything about it. We don't need to pat the head. We don't need to kind of, roll anything or do any shaping or any extra massages. It's not necessary. It's not required. Babies are born with all of this, lots and lots of hair. And obviously, as mothers, if we have a baby girl, we get very concerned, but don't. This is all birth hair. Most of it will fall off. And any which way is doing all the upton massages and etc. is only going to feel like pain for the baby. It's like waxing. So we don't want to do that to the newborn. We'll allow the baby to kind of, enjoy this period. If later required, once they are older, the hair still remains, you can always, have the laser treatments done. But it's a good idea to avoid the upton massages, at least in the newborn phase. Babies are also born a little cockeyed, which is really normal, right? So we don't need to worry about that. The eye muscles still need to be developed. And we can also expect that there is a little bit of leaking from the breast, which is very common. The breasts can look like this, a little swollen, whether it's a boy or a girl, and this is due to the maternal hormones. Maternal hormones will also cause the first period for your baby girl at about 8, 10, 12 days post-birth. And you will see a little bit of spotting like this, a little bit of bleeding like this in the diaper, maybe 2 or 3 times. And this is completely normal. So you don't need to worry about it at all, right? This happens to all baby girls. It's again the maternal hormones and the uterus doing a little bit of, extra work at this point of time. Umbilical cord is cut for you at birth, and then there's a little plastic clamp which is placed over there, and this is what you are going to be going home with. The cord will fall off anywhere between 8 to 10 days on its own. It will dry up and it will fall off, and that's normal. After that, the stump area, the umbilicus area will look a little swollen, might look a little reddish. You might also see a little bit of blood discharge there. That's normal. If there's any kind of pus, if there's any kind of inflammation, then you should definitely let the doctors know. But it's best not to apply anything into the umbilical area, and it's also good to not fold the nappy or diaper over this. So allow it to be free. Because if I put the nappy or diaper covering the umbilicus while it is still healing, chances of urine or feces touching this area become really high. Colic and crying. These are two very common things. So, in the initial few weeks, the digestive system is still immature. So babies may experience a lot of gas pain, which is normal. And, the doctors will give you colic drops. Please give that. Don't give all your home remedies. Don't give gripe water without checking in with the doctor first. Anything that you give to your baby orally, you should always, always check in with the doctor. That is very important, right? So there is also some gentle abdominal, concentric circle massages that you can do for colic, which is something which is recommended. But you should do this when there is no colic. And many times nothing seems to calm the baby down, and we have no choice but to wait it out. Colic can last for a few days, a few weeks, but the classic symptom is the baby cries at the same time every day, pretty uncontrollably, right? So, but the good news is that it is harmless. It doesn't have any long-term impact, and the baby will definitely outgrow it. There could be other reasons for the baby to cry also. It could be a dirty diaper. It could be, maybe some other discomfort. Maybe the baby is hungry. But it's also possible that the baby is just tired, the baby is bored, wants a good cuddle. So all of these are also reasons why babies cry. Crying is their method of communication. So we should not ignore a crying baby. We should always attend to a crying baby. Let's talk a little bit about mothers. Mothers are also going to go through a lot of emotional changes in the first few months. So we have two types of let's categorize them into two main categories. So there's the baby blues, which can last up to 2 weeks. If you feel that your symptoms are lasting longer than 2 weeks, then this could be postpartum depression. Now, some major differentiations are, in the baby blues, you have mild ups and downs. You might feel a little stressed out, a little anxious, But in the postpartum depression, your symptoms are very severe and you kind of appear irrational. There's no logic in the way your behavior might be. And it's very important that the family is aware that these things can happen. And it's not your fault. It's not that you're a mental case, right? It's not that you need a psychiatrist, but you definitely need help, right? So in baby blues, it's a normal transitional period where no medical help is required. But if it's postpartum depression, then special counseling may be required. Baby blues just needs rest, good family support, overall atmosphere of positivity. If everybody is supporting you, yeah, your breast milk is fine, yes, you're doing a good job, you're a great mother, all of these things over the next 2-3 weeks, you will settle down. But along with all this, if it's postpartum depression, I would really recommend counseling sessions with a therapist, because postpartum depression not only affects the mother, the family, but also affects the baby. Babies tend to be more withdrawn. They kind of, the developmental delays are seen. If the mothers have postpartum depression, it should be attended to. Mom is going to go through all of these physical changes. You are going to be sleep deprived. You have no choice. Absolutely no choice. The baby's stomach is small. Remember, I showed you that. So they do need to eat every 2-3 hours, and they are going to wake up multiple times. So, that concept of I'm going to sleep for 8 hours at a stretch in the postpartum period, at least for the first 6 to 8 weeks, does not exist. Because of this, there's going to be exhaustion. You are going to be tired. You are going to be irritable, of course, because of your hormonal changes. And that's normal. You really can't help that as well. You will be overwhelmed because you are now taking care of the full-time demands of a newborn. And newborns, basically, they only eat, they sleep, they pee, they poop, and they cry. That's all they do, right? Slightly older babies will look at you, they will smile, they will coo, they will react, they will kind of, do that bonding bit. But a baby of 2, 3, 4 weeks is only going to do these things. So you feel it's a one-way street where you're only giving and the baby is only taking, and you're not getting any gratification back. Just hold on, it will come. Once your baby starts kind of, doing the social smile bit, starts responding, your heart is surely going to melt and it's all going to be fine. There's also the concept of the body image, right? Because, we've gained so much weight. Our stomach is out, our breasts are leaking, our breasts are heavy. There's so much of that happening. I can't fit into my clothes yet. It's normal, just expect the fact that it's natural that you're not going to be able to fit into your clothes for the next few weeks at least. And then also it's going to be a snug fit. So just make sure that you eat healthy so that, the extra weight gain doesn't happen because of wrong eating habits. At this point of time in the post-delivery period, while your body is still recovering, there's going to be absolute lack of sexual interest. And it's also a little bit hormonal too, because postpartum, your vagina experiences a lot of dryness. And therefore, you kind of, don't get that feeling. And even if you are given the green signal by a doctor, when you do try having intercourse the first few times, it can be a little painful because of being dry. So that's something which is normal. If there are any dads listening in, or if the dads kind of listen in on this session after in the recording, just a little bit of support, just a little bit of understanding, get the moms back to it gently. Don't be in a rush, and indulge in a lot of foreplay, because that is what is going to help them to, come back to it with the same zest that was there before. Here are some very quick tips to ease the transition to parenthood. You need to read, and read. That's really, really important, right? So whether it's the books, of course, if you're going to read the internet, please be careful that you don't read all sorts of wrong things. And then, of course, there are classes like this, there are sessions like this, which give you a lot of information. Ask a lot of questions. You have your doctors, you may have friends who had babies, you have family members. Ask questions, but eventually remember the decision is yours. So make your own decisions. Talk and discuss your feelings and expectations. Don't expect people to understand what you want, right? So, many times mothers feel disappointed. My husband should understand that I have not slept at night. My husband should understand that he should take the baby for some time. My husband should understand that I need to take a bath. No, So if you've not slept well at night, say it. Say, I had a very bad night. I barely slept. I need to take a nap. That's your expectation, right? I want to take a nice, long, hot shower. Say it. That's very important, right? It's a good idea that you should plan for some help. It's good. Maybe whether it's your family, whether even if it means having some house help. So don't aim at doing everything yourself. I mean, I understand you're a superwoman. We definitely want that, and you are a super mom as well. But in the initial few weeks, while you're recovering, while you're getting to know the baby, while the baby is getting to know you, while habits, patterns, schedules are being set, you should have some help. Plan in advance and prepare for emergencies, right? Of course, we can't prepare for all emergencies, all eventualities. We understand that, but keep some backups. Like don't think that you're going to go rushing out and buying more diapers once the last diaper is over. That's going to cause you stress. So keep an extra pack ready in advance, right? So a little bit of pre-planning is very, very helpful. Don't blame yourself or your husband or whoever's helping you if all does not go as per plan, because this is also a baby, right? So it's a human being and is not going to respond, react exactly the way you want it to. So there will be some ups and downs, and it's not your fault. It's nobody's fault. You just have to be careful for the next time round. Another thing that is very important, which all parents should do, is set aside some me times. This is for mothers. I'm not saying that you're going to have hours and hours for yourself. You are going to at least try to find 30 to 45 minutes in a day, which is possible, right? So whether it's kind of, to dress yourself, put on some makeup, take a good shower, watch your favorite TV show, whatever it is. But some me time is very important. And it's also good to find time as a couple. Because for many couples, the only discussion that happens once the baby is born is how many times the baby pooped, what was the color of the poop, how many times the baby got up at night. I mean, yeah, I know baby is really important, but before the baby arrived, you were a couple and you had a lot of equations happening. You would discuss politics, maybe you would discuss, some new things that are happening, maybe your work. So there was a lot of other interesting conversations that you had. So you should find some time for those conversations also. Don't just have life revolve around the baby. That's something which is important to bear in mind. So let me show you a very quick video. All right, and here is a little gift voucher for you. This is from Mama Earth, which is a brand which promotes natural ingredients for skin and hair care. And they also have a lot of products for the baby as well. So what you're going to get is a 400 rupees voucher, which you can use for shopping on an extensive range of maternity and baby care products. So the Cordlife team will be getting in touch with you about 48 hours after this session, and they will be sharing this voucher with you, and they will also share the recording of this session with you. So just make sure that you kind of, take that call. If you want to learn more about stem cell banking, then you can also book a presentation. They will, do a video presentation so that, you're safe and there's social distancing, so you can understand all about stem cell banking and whether it's the right choice for you and your family. These are some of my books. If you're interested, they're available on Amazon. Prenatal Fitness, which is on exercise for pregnancy and postpartum, and each exercise is shown with a picture and proper explanation of the posture. And then Parenting Mantras, which is all about life after baby in a clear, concise, brief format, which will give you very good quick tips for the first 1 year. And then there is Supermom's Recipes, which is recipes for young kids. So 6 months and beyond, when your child starts eating, you could have this recipe book for your child as well. I am now going to open up the floor for questions. So whatever questions are already there in the question box, I will answer them, but I'm sure you'll put some more so that I have this. I'll leave the screen on because there are lots of contact details here. There's my website address. There's my Facebook handle at baby360degrees. I'm on Instagram at Sonali Shivlani. I would love for you to follow these pages. I'm also on YouTube. So the YouTube channel is the Pregnancy Coach by Baby360 Degrees. So please do subscribe because I was there. Some of you are already in our group, which we had created for this class. So you've been seeing some of the content and I've been sending it across to you. But obviously that group is going to get disbanded soon. And by subscribing to these areas, you will be able to stay in touch. I've also put the Cordlife numbers on the screen. So to receive your gift voucher and recording, of course, the team will definitely get in touch with you. They are very diligent. But just for your reference also, keep these numbers handy. So whatever you find convenient, the calling number, the toll-free number, WhatsApp or SMS. Just make a note so that you can kind of, get in touch for whatever needs you have related to the session as well as related to stem cell banking. Okay. So now we're ready for questions. So far there aren't any. If anyone has any questions related to what we've covered today, please do post it in the box. We have a few minutes before we close the session, so we'll be really happy to answer your questions. While I'm waiting for questions to come in, just as a point, there's absolutely no preparation required during pregnancy for breastfeeding. So if someone's asking you to kind of, take certain foods or do some massages, etc., it's something which is not required. Well, I am not sure what the protocol for that is as far as the earlier sessions are concerned. The pattern that we are following is that the people who attend the session are going to be getting the recording. If your due date is still away, then and if this happens again, definitely the team will be in touch with you for the same. Oh, okay. So then you do have time. Your due date is still far away. So you can, you'll probably get another chance to attend those sessions for sure. Since we generally do roll them over depending on how the Agarwal Nursing Home plans it. And you can also actually stay in touch with the Cordlife team because they will be also able to let you know when subsequent sessions are happening. Whether it's here or whether it's other sessions, if they do, they will definitely invite you. Thank you. So questions, any feedback, we'd be really happy to kind of, get your inputs. All right. So thank you very much for attending this morning. I hope you had a great Sunday session, and look forward to seeing you on my social media and staying connected that way. Thank you, everybody. And thank you, Dr. Meera. Thank you, Cordlife, for giving us the opportunity to have this conversation on this Sunday morning. Have a great day. Have a great weekend ahead. And wishing everybody a very happy Diwali in advance. Thank you so much, and good day to you.